I'm Dr. Shraddha Bhange, and I have done my medicine. I'm a physician by profession. After practicing for almost 2 or 3 years, which included also working in oncology hospital, I chose to join pharma company, and I'm working in oncology space with pharma companies as a pharmacovigilance physician, because I think cancer and oncology space is where we need maximum number of physicians working to bring on the new therapies, bring on new and effective methods to actually fight cancer. So you cannot restrict physicians only to clinical practice. I mean, we need them in research as well, as much as we need them to treat the patient. As long as we have equal balance, I think we can fight cancer. So that's what my motivation of joining pharma was. And I have always been more happy when I'm working with oncology drugs, and especially pharmacovigilance, because I think that's one of the areas that stops a patient going for therapy. Like when a person is diagnosed with a cancer and they are given a choice, their first question is, I don't want to take chemotherapy because it will cause it will make me lose my hairs. I will have lot of nausea. I will have diarrhea. And I want to make sure that we are taking care of those side effects, so that it doesn't stop patients from taking treatment. I want the treatment to be more effective, more safe, more beneficial, and I want people to be able to trust medicine and pharma companies to actually give them a motivation to go for a chemotherapy and not see it as a problem. So that's what my motivation to join pharmacovigilance.
I'm here in Tanzania on a charity mission, and I've been coming back and forth for the last 5 or 6 years. And a few months ago, in July of 2018, I came back to do a trip across East Africa, and I went through Uganda for the first time. And when I was in Uganda, I met with some people in a small village, a very, 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 very remote area of Uganda, in the southwestern part of Uganda, near the Rwandan and Congo border. And this village was quite special. And because they're so remote, they just don't have any access to adequate healthcare or humanitarian resources. They're very, very poor, but it's also just a very special place. So my heart felt that I needed to do something for this community. So that's when I decided to set up Pendo Project and our main office, and we're now a registered NGO in Uganda. But up until that point, all the work that I'd been doing was here in Tanzania.
I would like to take a chance to tell people about pharmacovigilance in a more productive way, like exactly what we do, because it's one of the branch that is ignored, and people are not aware of it. People feel that they should have drugs which don't have any side effect at all. And they have these expectations, when you eat a candy, sugar is not good for us, still you eat it. So what do you expect from drugs? I mean, they are not magic created by superpower. They do have a side effects, and the reason we have pharmacovigilance or drug safety physicians working is to ensure the drug is not doing more harm than the disease. This is where we come into picture, to make sure we know what type of harm it can cause, to be one step ahead to prevent that harm. And the reason we are in this industry is to tell people that the reason we are asking for more data is not to create files, is to prevent side effects, is to save lives, because if I know that so and so drug causes liver enzymes and can cause liver damage, I am more careful. I will not give it to patient who already has a liver damaged. But if we don't know this, then we are actually putting the patient in a position where before the disease can kill him or her, we are killing the patient by giving him the drug. So to prevent this, this is where we come into picture, and we want people to know that when they have a side effect, the industry term is adverse event, but I'm using side effect for patients. So when they have it, they should go and report it. And even for healthcare professionals, sometimes they feel that we are doing a desk job, we just collect the data, we don't do anything about it. But when you go and buy a drug from a pharmacy and you see there is a paper inside it, how to take it, what you should not do, you should not drive your vehicle, you should not operate machinery, that's there to prevent you. That's there to save your life, that's there to prevent any problems you might have. And it's very important for people to be aware that this can only be achieved. We can make a lot of new drugs, we can bring in the market only if we work together to monitor them. So we should work together with healthcare professionals and pharma industry who are doing this job. We need to ensure the drugs that we give to patients are safe, not just effective, but safe. Because a drug can be effective, but at the same time, it can be an unsafe choice for that patient. And we can only know if we have collected the data and have done our homework.
The plan is I have three cases of supplies. So we've got a lot of medical supplies. We have some clothing and some sporting supplies, sporting goods. We've got a whole bunch of soccer balls and soccer jerseys, and a few things for the Pendo Project office. So one of the objectives is to bring these supplies directly there so that they don't get lost in translation somewhere along the way if I were to send them by bus. But the main reason why I really need to go to Uganda is because the village in Uganda, since we've set up the Pendo Project, I need to talk to we have to have a village meeting, because there seems to be, and this is a very common thing that happens here in Africa, when a Mzungu, when a white person gets involved, sorry, that made noise. So when a Mzungu, a white person gets involved in anything, they think that there's a lot of money involved. And so I feel I really need to go and explain to them and introduce myself to them and explain to them that I am just a normal human, that I don't have a lot of money, I'm not a wealthy person, but that I'm just there to help their community thrive. And by having our Pendo Project presence, it'll be able it'll be a draw card for tourists, because at the moment a lot of tourists go through that area because they're in the middle of the Bwindi National Park, which is where people go to see the gorillas. So it has a high tourist influx, but there's nothing there for the tourists to sort of do or be. If anybody wants to help that community, they don't know where to start, so they just kind of filter through. So having the Pendo Project office there, it will give them a place where they can go. If they have clothing that they want to donate, they can drop it off at the office and they'll know that it'll be distributed to the people who need it the most. I'd like to have the local people who do artisans and crafts to have their things on display in the office so that we can sell them on their behalf, and then that way people will be able to find them, because at the moment everybody's scattered around and there are no resources there. You'll see, I'll send you videos when I get there, but this place is very, very, very remote. They're about 8 hours from the next nearest city. It's a village. It's a village in the middle of really nowhere, really close to the border of Congo, which is a very, very poor country, and Rwanda. So it's off the beaten path. It's not, other than the gorillas, there's really no reason for anybody to go there.